Good morning everyone. Thank you Ansi and readers of Lifestyle Today News asking me questions on doubts of people regarding coronavirus. I have been given a set of questions. I have tried to group them into sets so that there is minimum repetition of answers. However, there will be repetitions. I apologize for that, but I hope it clarifies some of the doubts in your minds. The first question is, according to experts, the pandemic is not going to end in July. Will it end? The experts are basing their information on facts of previous epidemics and the behavior of coronaviruses. We have had SARS-1, we have had Middle Eastern respiratory disease. So these are the experiences which help to guide us our understanding of this disease, and therefore they are modeling. Mathematical models have been done. They are modeling to show that possibly by July or maybe even August, the epidemic will come, reach a peak and then gradually settle. Historically, if you look at epidemics, they have all been like this, including the Spanish flu, which came, lasted for quite some time and then eventually disappeared. So it's not that these pandemics will be there forever. They will eventually be overcome by human immunity and resistance to fight against viruses. Therefore, it's difficult to answer when will this pandemic end? How long will it last? That's the next question. We don't know, but usually pandemics have a history of infecting a certain number of people and then petering out. So there is a growth curve which may be steep or slow, reaches a peak, then grows down. That growth curve starts going down only when a certain proportion of the population is infected, which then have the resistance to fight against the virus. This is called herd immunity. When a large number of people in a community have been immunized by the infection, they have herd immunity. What is the percentage of people that need to be infected to get herd immunity? There are experts that until recently have been saying 60%, but there are some recent reports saying that even up to 20 to 30% of people being infected gives you sufficient herd immunity for the pandemic to end. So anybody who says that this is going to end in 10 days, 15 days, it's all guesswork. We do not know, but we hope once herd immunity of a certain proportion, somewhere between 20 and 60% is reached, we will have overcome the pandemic. Will the virus be eradicated like polio or smallpox? Remember, smallpox and polio both are viral diseases. Both had an excellent vaccine against them. Smallpox was the first disease that mankind eradicated, and the eradication was based on two factors: case identification and case containment. In smallpox, case identification was easy because of all the pustules and the vesicles that formed on the faces. So in any village, anywhere in the world, you had to identify and then you cordon off the area around, and we had a very good vaccine to vaccinate people. Polio was a different ballgame. Polio was eradicated from the Western world not by vaccine, but by the sanitation and water supply being made good. So safe water supply and good sanitation were the two tools which helped the West to overcome polio. In India, we have not been able to provide safe water to all the population even today, and 100% of the population still does not have sanitation, which is good, and therefore we had to rely on the vaccine as a fix to eradicate the virus. In coronavirus, we do not have a vaccine as yet. It will take about 1.5 years at least before a vaccine comes. Even then, if you look at the flu vaccines that are available today, they do not provide you permanent immunity like smallpox or oral polio vaccine does. They give you a limited period immunity. So, flu vaccines need to be given every year to protect the elderly from the effects of a flu-related pneumonia. We do not know how effective will the vaccine from coronavirus be. We'll have to wait and see. Until then, we cannot answer this question, can we eradicate it or not? But looking at historical behavior of flus, unlikely we can eradicate it forever. Is there any possibility of home testing for coronaviruses, and is that legal? As yet, there is no home testing available, so the question of legality doesn't come. We don't have such a test. In the future, there may be, and it may be useful to test that, but at this point of time, we do not have any home testing that is available with us. Is immunity the biggest weapon against coronavirus? Yes. The first virus that was identified, you know what it was? It was a plant virus, tobacco mosaic virus in 1891. The first human disease producing virus, you know when it was identified? 1901, it was yellow fever virus. Remember, till today, 120 years down the line, we do not have a drug to cure a virus illness. So how do we overcome virus illnesses? We overcome virus illnesses by body producing antibodies which fight the viruses, kill the viruses, and we win. Those antibodies that the body produces is what gives us the immunity. So when somebody says that I am immune, it could be because I have had an infection and become immune, or it is because I have been vaccinated and become immune. Either of the two are essential to have immunity. So what is this natural immunity? No, it's a healthy individual who can raise antibodies in sufficient numbers and strengths to fight the virus. So when you say you have a good resistance, you are saying that you are a healthy person without any malnutrition, without any other illness, which may be lifestyle diseases or other diseases which make you vulnerable and immune compromised, and therefore vulnerable to get the infection. The next question is, how do you increase immunity? Your health is based on a balance of things, balance of what you eat. You have to have a balanced diet, which means a proportion of food has to be carbohydrates, proteins and fats. Laborers need to take a large amount of carbohydrates. People that are inactive take less carbohydrates and less fats and more proteins. And you need to have a balance of physical activities also. But that's not sufficient. You need to have minerals. Minerals like zinc, like copper, various other minor elements are required for your enzymes in your body for fighting and producing cells for fighting viruses. So these we get from the natural foods that we take, like the vegetables, like the nuts and the pulses that we take. So we need to take a balanced diet, stay healthy, and physical activity keeps our body fit. Intellectual activity keeps our mind fit. So we need to have physical health, mental health and a nutrition that is balanced and good to maintain our body health. That's what good immunity baseline foundation is. Most people have to venture out for work, essentials, medical emergencies. So how do we protect ourselves from being infected? This is basic. Everyone has to remember. First we need to understand how does the virus spread. Virus spreads from one person's breath to another person's breath. So if you're close to each other and breathing into each other's nostrils or mouths, you're actually infecting each other. So if a person is within your breath air distance, you're likely to get infected if the other person is infected. Therefore, how do we prevent this? We can't stop breathing, we continue to breathe, so we need to wear a mask. So the first safety step is a mask, a good mask. A cloth mask with porous layers in it doesn't work. It has to be a mask with multiple layers which prevents the viruses. Remember, viruses are very small particles. It can go through the pores of your cloth mask. So therefore, you need to have a mask which has the filtration capacity to filter the viruses. But remember, any mask is better than no mask. So if you don't have anything, definitely use a multi-layered cloth mask, at least 2 or 3 layers, so that the probability of the virus entering your airway is less than normal. So mask to protect you from the other person's breath. Number 2, keep a safe distance. This is debatable whether you say 1 meter or 2 meters or whatever, but by and large minimum 1 meter distance should be kept, and that is important to prevent you from getting infected from the other person's aerosol, is the droplets that come out of his breaths when he breathes. Again remember, if you are shouting or you are singing, you bring out more aerosols. So if you are standing opposite somebody who is singing and is likely to send the aerosols further down the line, maybe 3 meters also, 4 meters also, be careful. So it's important to have the mask. So most important step is mask. Second important step is keep distance. Sometimes these aerosols, small droplets, fine droplets which contain virus particles, land on your hands, and any human being touches his or her face at least 20 times in an hour. So from our mouth, from our nose, from our eyes, we get the viruses onto our hands. And when we touch objects, we transfer the viruses from our hands to the objects, or when you cough without a mask, we put those aerosol droplets on the objects around us. So the objects around us are contaminated, and if somebody comes and touches those objects, it will transfer the virus to the hands. Therefore, the third most important thing is hand washing. Regular hand washing, especially don't touch foreign objects outside your house. Unless in your house there is somebody infected on home quarantine, then don't touch any article that he's touched. Don't go to his closer than 1 meter, don't go to him without the mask. You have to be very careful. So any outside object you've touched, wash your hands. Any unknown person bringing you an object, wash your hands. Anybody giving you some items through courier, wash your hands soon after you've touched. So those objects and the viruses remain intact on these objects for varying period of time. On steel it's supposed to be 4 hours, 5 hours. On cardboard it is 5 to 6 hours. On different surfaces, varying period of time. So if you have a doubt, leave the object untouched for maybe 5-6 hours, and that is sufficient enough. So key precautions: 1, mask; 2, safe distance; 3, wash your hands regularly, and that's important. How do you wash your hand? I say that soap and water is enough to wash hands. Why do I say that? Because washing hands with soap and water is the best way. The virus has a coating, and that coating is easily washed away by soap because it has got a lipid content. And what are lipids? Lipids are fat related substances, and you know oils are washed only very effectively with soaps. Therefore, soap is the most efficient. I am not happy with sanitizers. One, it's expensive. Two, it's difficult for poor people to get sanitizers. And three, they finish off in no time. And four, because you want to conserve the amount of sanitizer that you use, a small amount only. So you'll put a little bit on your palm and rub. That's not sufficient. Use it liberally. Rub your hands nicely, back, between your fingers, your thumb, all have to be, and that's the same technique for washing also. So the steps for cleaning your hands with sanitizer, cleaning your hand with soap and water remain the same. These, every finger, front, back, thumbs separately, palms, everything have to be cleaned properly. So soap and water is the best, but in the absence of that, you can use a sanitizer. And liberal use of sanitizers, not thrifty use of sanitizers. So should we also use soaps for washing vegetables and fruits and packed grocery? No, you don't have to do that. Vegetables are usually cooked and eaten. Washing them in good amount of running water is sufficient. On top of that, you are cooking it. However, if you have salads that you are consuming, make sure that you washed it thoroughly with running water. You don't have to use soap. I have seen people using soda bicarb, washing soda, detergents. No, some of the detergents will soak into these vegetables, and some of these may be toxic, especially washing soap. You don't want them to be consumed in your body. So running water is good enough. If you are very worried, you may use warm water and wash these vegetables that you are going to consume raw, or fruits that you are going to consume. Wash them thoroughly with water. That's running water. That's good enough for you. There is a recent report that sunlight will help you fight the virus. How effective is sunlight to fight the virus? Look, sunlight has a spectrum of rays, from the very narrow spectrum to the very long spectrum, infrared to ultraviolet. Ultraviolet rays do kill the viruses, but they need to be exposed for a certain period of time. If you are thinking of getting yourself sunbathed, remember ultraviolet rays are also bad for your skin. We do not recommend it as a method to protect yourself from the virus. However, if you are thinking of keeping objects in the sunlight which have been probably contaminated, you may keep them out in the sun, leave it just drying and keeping in the sunlight for 5-6 hours may be good enough. One important area which you may use the sunlight is for your masks. Any surgical mask which you buy can be reused provided you dry it sufficiently. So you take 4 masks, number them 1, 2, 3, 4. First day, wear mask number 1. Second day, mask number 1 goes on your washing line, leave it in sunlight and use mask number 2. Third day, the second day washing line mask goes up and mask number 3 is used. On fourth day, mask number 3 goes to the washing line and mask number 4 is used. On the 5th day, mask number 1 comes back and you recycle it to a maximum about 28 days. So one set of 4 masks can be used for 28 days. This has been found to be reasonably sufficient for recycling of your mask, and that's where only area where I would use sunlight to protect yourself. The next question. Curiously, some of the coronavirus positive cases are those who have never ventured out of the houses for 6 months and followed all the precautions at home. How could that happen that they got infected? It is not possible that they have had no contact and yet they got infected. The virus did not come out of thin air. It came through a source that was infected. Okay, so it has to be they handled some object, they handled something, they met somebody coming to their house who was infected and therefore they became positive. It is not possible that there was no interaction for the chain of infection to continue. There has to be some interaction from some infected person, either directly or indirectly through objects of exchange, maybe notes, handling notes, maybe some other package that was given by a courier. There have been reports of pizzas delivered by pizza delivery boys that were infected, they infected people. So it could be anything that the virus landed to your body from. There is a doubt in everyone's mind in these 3 months that we might already have been infected and healed from corona. Yes, it is possible. Many of us have had mild flus, colds, cough and no other symptom, and we became all right. That's exactly what was seen in the aircraft carrier Theodore Roosevelt, where it was found that 60% of the young healthy men were infected but asymptomatic. So it is possible you were infected and you got cured. So in such cases, will we be able to find out if we were infected? Yes, there is a way to find out, and that is by testing for antibodies. The problem with these tests is the antibody tests are not so reliable as the antigen test, as we call as real-time PCR. Those are far more sensitive and far more specific, whereas the antibody test, what is an antibody? Antibody is a body created by our cells to fight the virus. So it is something in your blood which is protecting you from infection from future. So if you have an infection, initially there is no antibody because the virus is just a completely new organism that has entered your body. As it enters, the body recognizes it as foreign and starts fighting it. And as it fights, the antibody level goes on increasing till it reaches the peak and the body wins, or sometimes the virus wins and the body dies. So usually the body wins. 99.5% of cases the body wins and we are able to eliminate the virus. So those are the antibodies. So testing for antibodies will help us identify these cases. Are there any long-term side effects for a coronavirus patient? The virus, since it has been identified, has been only 6 months old, causing its symptoms and the disease. As yet, it's too early for us to see are there any complications which are long term. Short term we know what is happening, but long term we do not know, only time will tell. Most viruses, they do not leave long term effects except for a disease like poliomyelitis and few other viruses which leave long standing damage to the body. But by and large, coronaviruses do not belong to that category, and therefore we do not expect, but time will tell. So at this point of time, I can't answer that question. When largely the elderly and those with comorbidities have succumbed to coronaviruses, some young healthy people with no health issues died due to coronavirus. What could be the reason? Again, difficult to answer. But in my hospital, I have been keeping track. We have a 200-bed corona ward in our hospital, and we have been regularly treating right from the beginning of the epidemic. We have had cases coming to us. And what we have found is 90% plus of those patients that have died, whether they were young or they were old, were diabetics. We don't know what happens in them. For some reason, the diabetics have been vulnerable, and those that have died have shown significant changes in their lungs. And what has been described in the lungs, earlier what was thought to be a pneumonia, was later on found to be not pneumonia, but clotting in the vessels of the lungs. So in the lungs, what do lungs do in our body? They oxygenate blood. This oxygenation happens because blood is flowing through the alveoli in the lungs. And when the blood vessels are clotted, flow cannot happen, oxygen cannot happen, and patient dies in the absence of oxygen because of the tissues not getting oxygen for survival. And that's what happens. So some of these patients who are young and dying have been described to have what is known as a cytokine storm. What is a cytokine storm? It is a reaction mounted by the body to fight the virus, but the reaction is an overwhelming reaction, and that actually causes side effects to the patient, and the patient dies from that. So the younger people dying are usually ones who have a cytokine storm, and usually these are the ones with diabetes or some other major illness. What is the precaution to be taken by pregnant women, especially while going to the hospital for checkup? The precautions remain the same. Mask, distancing, hand washing. They remain the same. Remember, when you are pregnant, a pregnant mother is two lives, the mother and the child. So there's a double reason for to be as cautious as possible, keeping away from crowded outpatient areas, keeping away from closed and poorly ventilated areas, poorly ventilated doctor's chambers. Make sure that when you go, you should have seen the clinic earlier. It should be well ventilated. The number of air changes should be good so that your probability of getting the infection is low. So extra precaution on the mask, on distancing, and on your hand washing. Can we accompany the child along with us? I would not recommend that, except in a dire situation where no one else is home to protect the child, to be with the child. You may carry the child, but remember, children may be impulsive. They suddenly go and touch things. They may suddenly interact with people. They may start to, they may pull off their mask. So therefore, because of impulsiveness and unpredictability of behavior of children, we do not recommend that children should be accompanying pregnant mothers for antenatal care. The next question is, you have directly handled patients during trying times, be it HIV positive patients or coronavirus patients. What is your advice to the medical professionals who are directly dealing with coronavirus patients? My advice remains the same. If you protect yourself, you will be able to take care of your patients better. So while I myself have seen so many patients who are coronavirus positive, frankly infected, I have dealt with them, and for the last 3.5 months now, I have been dealing with patients every day. But I take my precautions. My job as a physician is primarily responsible for patient care. I have taken the Hippocratic Oath, and I will care for my patients come what may. And this was what we noticed when HIV epidemic came up. Huge stigma against those HIV victims. Then they started coming out with innocent victims and not so innocent victims. Those are all judgmental issues. We should not be judging people for an infection. We should not be stigmatizing people for their infection. Our job as professionals is to take care of these patients, and we do it to the best of our ability without any stigma. However, while we do it, we protect the patient and we protect ourselves. How do we do that? Make sure that we wear a surgical mask. If it is close contact, it has to be an N95 mask that we need to wear. Number 2, if you are going to do an invasive procedure, we must wear gloves, or if not, we must wash our hands before and after, both. How do you assume that you've knocked the infection from somebody? You may be infected without you having any symptoms. So you need to wash hands before you touch the patient, and after touching the patient you protect yourself by washing hands again. So before and after washing hands, and as far as possible keep away from the breath area of the patient. And if you have to touch the face, the eyes, the nose and the mouth of the patient, make sure, or any other invasive examination is to be done, make sure that you are wearing gloves. Don't do it without gloves. Maintain distance, and any object that you use after touching the patient or any object that you use on the patient should first be sanitized, used and then sanitized again. Stethoscope that I use for seeing the last patient of backache. I am an orthopedic surgeon. You will wonder, how do corona patients come to me? Yes, they come to me with backache. Body aches are common in viral infections. They came to me with backache. They didn't know they had corona. I didn't know they had corona. I examined them. I suspected based on some of the questions that I asked and sent them. They were confirmed to be coronavirus patients. So we need to be careful. The protocols are the same, protecting yourself and protecting the patient. Hydroxychloroquine is used to treat lupus, rheumatoid arthritis and malaria. Does that mean that those with these conditions can kill two birds with one? No. Don't get wrong impressions. The diseases of lupus and rheumatoid, these are autoimmune diseases. What are autoimmune diseases? These are diseases that the body immune system fights its own cells. Normally our immune system fights foreign cells, viruses, bacteria, allergens. But in this type of a condition, systemic lupus erythematosus or rheumatoid arthritis, these are autoimmune diseases where the body fights its own cells and causes disease. So the body immune system is busy fighting its own cells. So if an invader comes, you are vulnerable. So even if you are taking hydroxychloroquine, your invader will have an upper hand. It's just like internal strife is ripe moment for an external enemy to fight and win over you. Similarly, malaria is an external infection because of a parasite. So there is a fight between the body and the malarial parasite. So you are actually fighting one war inside your body. When another invader comes, even if you are taking hydroxychloroquine, that invader has an upper hand. So that kind of a cross protection does not happen. So you are not winning two wars at one time. Some people still believe that coronavirus is a myth or a conspiracy. What do we have to say? As yet, there is no evidence to show that coronavirus has been created as part of bioterrorism. We do not have any evidence to say that. There are hypotheses, but it has not been proven anywhere. The only proof we have is coronaviruses, which are ordinarily seen in bats and some of the animals, and most commonly in bats. Bats seem to have about 500 species of coronaviruses, and they are a real storehouse of coronaviruses without any disease in them. But when it jumps from viruses, from the bats to human beings, you have the disease coming. Has there been an intermediary? We do not know. But remember, when we tinker with nature too much, when we tinker with the natural habitat of these animals in the animal kingdom, you are likely to have an interaction between the viruses in the animal kingdom and the human interface, and that's when we have diseases jumping from animal kingdom to humankind. So a key message that is there in this pandemic is we should not ruin our environment, we should not ruin our forest, we should not unnecessarily damage our animal kingdom. They are all part of an ecosystem. We are part of that ecosystem. We have a responsibility to protect the ecosystem to stay safe. So what is my concluding message? My concluding message is the virus is here. It will have a natural peak, it will die down naturally. A vaccine is the way to protect it for a longer term, but a vaccine will take minimum 1.5 years to come by. Until then, the only way to protect from the virus is prevent spread of the infection from one human being to the other. Wearing a mask, keeping a safe distance, washing your hands regularly, and staying away from places where people gather and we do not know who is infected, who is not infected. Thank you so much. Keep safe. All the best.